Hi guys, welcome back to Caapid Simplified. It's been a while, and I thought, when I'm coming back, I'll bring someone really special back to y'all. So, out of this whole, uh, journey to find new and new dentists for y'all to speak or international students for y'all to speak to, I stumbled upon, quite honestly, stumbled upon Dr. Khushbu here. One day while I was networking, I was talking to dentists, and that's how she's here, and she's kindly agreed to come on our channel and speak to all of you and share her journey, speak about her profile, speak about her application, and give you some insights. Dr. Khushbu, hi. I am so glad that
Hey,
you're
how
here.
are you?
I am good, thank you. We
Glad
did,
to be here.
yes, we did have to cross a few roadblocks to get here, but we're finally here. And I'm glad we could find the time. So before I I pass on the, opportunity to her, I'm just going to quickly, for all the new viewers and for the ones who've forgotten, I'm just going to introduce myself again. I'm Flynn, and I am your coach at Caapid Simplified. And today we're going to speak to Dr. Khushbu. So she's, like I said, she's a student, DDS student at Nebraska Medical Center. So yes, Khushbu, I'm just going to let you speak, about yourself, a brief introduction for them to get to know you before we go on to questions. Over to you.
Thank you. Thank you for my sweet introduction. Okay, so my name is Khushbu Ijner, and I'm originally from India. And right now I'm a I think third year University of Nebraska Medical Center student.
Mhm.
And I got here last year. So this is my second year, and then I still have to go complete my one more year here. So yeah.
That's pretty much you. So, to a little further on, tell us a little about your profile.
So I'll start with my profile. When I came to the USA, it is in 2018.
Okay.
After marriage, I came just like it's a yeah. After marriage, I got a visa, and then I came to the US. Before that, I graduated from India in 2013. End of 2013, so almost I got the license in 2014 to work as a general dentist. So in India, I was working as a general dentist for 4 years before
Mhm.
I came here. And
Mhm.
then once I am here, I started looking for different opportunities to work here
Mhm.
in the private practices to see how the private practice work here, and is there any nearby dental college. But
Mhm.
unfortunately, I was in New Hampshire, and New Hampshire doesn't have any dental college in the state.
Of course.
So I found out that I can apply for dental assisting work.
Mhm.
So I did search in Indeed and LinkedIn. First opportunity I got into the S band, which I didn't know anything about it.
Mhm.
So then, but I did not get into the dental assisting there because they thought that my education is a little bit more for dental assisting. And I was like, okay. And then I did try for another job interview and all, and I got in a nearby place to my house, so which is good. And
Okay.
then started preparing for my initial boards and TOEFL, and
Mhm.
finally applied to the uh, CAPID in 2020.
Mhm.
And
And you got
my school started in
it.
2021. First cycle, yes.
That is
It
quite
was
big,
first.
right? That is
Yeah.
very impressive. Not to say that you need to get on your first cycle. To anyone who's listening, that is not the moral of the story. Just that it's nice to get in the first cycle.
Yeah, it is nice, and I did not expect that, honestly, because that was a COVID-19 who just started. So I was just thinking, let's try, and then we'll see what the response is and how I should behave in the second cycle. So
Yeah. How many did you apply to? How many schools did you apply to in your
I
cycle?
think I applied 8 to 10 school, not many, because I was struggling with my TOEFL score.
All right. Okay. More on that later. So let's begin at the most general question that mostly everyone has, right? So you graduated in 2013 or 14, say you got your license
Yes.
to practice in 14, and you applied in 2020. So that's a good 5 to 6 years. So
Yes.
how did you build your profile from then till the time you applied? Maybe not intentionally because maybe you didn't know that you're going to apply to the US. However, what all do you do, and what do you do after you come to the US to build your profile when it comes in?
Okay, yeah. So, just you said, I did not plan to build up my profile to get into the dental school, but I was always excited to see how the education looked like in the US. And fortunately, my husband and we moved here to the US, got the opportunity to work continue my study. So once I finished my graduation in India, I thought that I should just do the general dentistry because uh, in 2014-15 we already like knew that I'm gonna go to the USA. So then I did not try into the residency over there because I know I want to do the international DDS in the US, and regardless of the like mm, MDS or something, I have to go through procedure. So during that time, I was looking for sources in India, but it was really less, and I couldn't able to get the information about national boards. I was just wondering what is the procedure look like, and then one day I found that I had to go through so many steps to get into the school. And
Yeah.
after that, I was wondering, in the school, I also have to take some exams, and to get the license, I again have to give some practical tests and that's and all. So during that time, in my general practice, I was focusing more on practicing my hand skills.
Okay.
So crown preparations, root canals, scaling root planings. What those are the simple procedures that we usually do in India. So for 4 years, I in C programs, I was financially a little short over that time, so I did not do so many CE programs over there. But whatever online, I just Googled it and try to see what I can do. So, but the good thing is I got a lot of exposure over there for different procedures, how to talk with the residents over there, find like major problems or major procedures like third molar extractions or major surgery, cysts or abscesses, because we have more that kind of a patients, tobacco and all. So then once I moved here, I started my search for dental assisting, and I got into the dental assisting work. The environment was really good. But the thing is, as a dental assistant, I am responsible to work to clean up the room and then observing and then um, assisting the dentist actually, which is different than I used to work in India. So I just mentally thought it is short time. I need to complete my initial boards, and till that time I have to finish this. And then there I just got to know the practices over here. So practice here, I got in three different nearby towns to go to the dental work. But during that time, it was like private practice is really small, and they have they have patient appointment. So then I was like, okay, so I just have to work 8 hours, and every hour I have one or two patients maximum. And then work for cleaning and putting the patient's notes and nothing more. So I did for 2 to 3 months, and then I got bored. And I thought, let's focus on the national board because this is the first thing I want to complete. And then I worked 6 months because I need to go to the different offices to work and all. So I got the job again as a dental assistant, which is also near to my place, and which is a little bit different than the previous one.
Mm-hmm.
uh, this practice has a lot of new technology, a lot of and like CEREC machines and all. So I was a little bit curious to learn something new, as well as I got my radiology license from the Boston University. So I get to know the university near to that. So so everything is getting together during that time. And then I got the recommendation letters from my professor from my college from India. So it was a little bit different. But because of COVID, I got little delayed in application. So I finished my application in June.
Okay.
In
So to sum it up, I
and
think more of your profile building was clinical, right? Even in back
yes,
in India, you had clinical experience. Here you came and got your DA. You're working as that, so it was leaning more towards that, right?
okay. Yeah, mostly it is clinical, and during my internship process and when I was in third year in dental college, I did go to the civil hospital near to my house in India. So that
Okay.
was also a different experience than routine, because I got to know more of oral surgery procedures. So yeah, more I really wanted to know more about clinical dentistry rather than doing research or educational purpose.
So I just want to pause here for a minute and like tell whoever's watching and listening that this is one point here. Like there's no blueprint. Like there's no particular profile that gets through. If you want to do research, if that's in what interests you, take that up. Do more of that, right?
Yeah.
But if you want to do clinically, do more of that. If your profile and story is based on volunteering and helping people, then do more of that. But in general, like Dr. Khushbu said, clinical exposure and volunteership because basically whatever you get to do in the US adds a lot of value. So once you get to the US, try and get some kind of experience, whatever suits you, and however whatever is easier to get as well. And another thing that she mentioned that I'd like to highlight is the FB groups, because I've by speaking to a lot of applicants, I've realized that a lot of our mentees are on the groups, but not really everyone really engages in it. But that's actually a very good place because a lot of your peers, talk about sale and bench materials, volunteership activities, a lot of opportunities to assist and shadow in clinics. So that is a very good place to keep an eye out. So you wrote three times and you progressed in the last time as well. So just quickly, do you have any tips and tricks, any resources that you want to tell the viewers, because a lot of them are preparing for TOEFL now. Next few months, a lot of them will be writing. Anything, any advice from your side for them? Any
So
resources?
after one or first and second time, there's feel that we feel like there's black hole. We cannot do anything more than that. But the thing is, I practiced from Noteful. There are plenty of videos on YouTube that you can follow, but uh, the the only thing you can do is practice.
Practice,
So
yes.
practice maximum time. I did everything. I did listen to the songs. I did listen to the lectures and speaking. I tried myself in front of the mirror speaking and everything. That all gather, and then during exam nothing works but only your confidence. And then reading section, you just had to go through the material. And I got some trick from Noteful, I would say, maximum from the Noteful. And then I got one of the private tutor because I don't know what to do. Before Noteful I did that,
Okay.
but that is kind of also we have to pay for one or two lessons, and then we don't think it is going to be working for us or not, because that's just one or two lessons, right? So
Correct.
my thing is just practice more and more and you will get your score and nothing else.
Uh, how did you go about that?
Right. So be honest, whatever you are wanted to get at the end. So think about that first. So my thing is I want to get a more clinical exposure. So I looked at the school which has more clinical practical work to do.
Mm-hmm.
And then I shortlisted my schools.
Mm-hmm.
And then in SOP, whatever you have done till the date,
Mm-hmm.
just jot down all the points. As I would say, make a story of yourself.
Yes.
Even it is hard to get the topic, how to write the SOP, but just think about it. Uh, when you were old, how you get into the dental school? Your wish, you are not like, if you don't know how to write, like, why you get into the dental school, that is also a story. So write it down. At least you write something and then think about it. Then and only you will make a story. And no one is a story maker except the movies and all. But yeah, you need to just write down whatever you have done,
Yeah.
whatever the small thing. For example, I like to cook. So
Mm-hmm.
the cooking is also the skill you can
Mm-hmm.
write down in your profile, and painting or
Yes.
anything what you are doing at home, you can
Yes.
write it down in the profile.
I agree. I think a lot of like even with our mentees, we see that they hesitate to bring out things that are non-dental, but that's I don't think that's true. You sort of lace in whatever you're doing into your story, and I'm sure it will sort of connect with dentistry in some way or the other. And yeah, I mean, you put it
But
the I think the
yeah,
best way.
like
Story is
everyone is a graduate from dental school in particular countries, so you
exactly,
have some
yes,
quality. So just focus on the
yeah,
quality and write it down in the SOP, and make a clear picture what you want to show to the college director or
yes.
something in the SOP.
I think
So
some.
when you were old, how you get into the dental school? Your wish, you are not like, if you don't know how to write, like, why you get into the dental school, that is also a story. So write it down. At least you write something and then think about it. Then and only you will make a story. And no one is a story maker except the movies and all. But yeah, you need to just write down whatever you have done,
Yeah.
whatever the small thing. For example, I like to cook. So
Mm-hmm.
the cooking is also the skill you can
Mm-hmm.
write down in your profile, and painting or anything
Yes.
what you are doing at home, you can
Yes.
write it down in the profile.
I agree. I think a lot of like even with our mentees, we see that they hesitate to bring out things that are non-dental, but that's I don't think that's true. Sort of lace in whatever you're doing into your story, and I'm sure it will sort of connect with dentistry in some way or the other. And yeah, I mean, you put it
But
the I think the
yeah,
best way.
like
Story is
everyone is a graduate from dental school in particular countries, so you
exactly,
have some
yes,
quality. So just focus on
yeah,
the quality and write it down in the SOP, and make a clear picture what you want to show to the college director or
yes.
something in the SOP.
I think
So
some
they will
level of
know what your clear
reflection.
purpose is.
Yes, correct. I think some sort of reflection is required in like before your application. Because just to collate your thoughts, gather your thoughts, just to know what you're going to write in your SOP, and because SOP is a starting point, right? After that, whatever you write will have to be consistent with your SOP, meaning some that the energy or the tone of it, because you're the same person writing it. So all of that should come together because if you're writing your application genuinely. So I think it's very important to sit down and sort of put your thoughts together and experience together.
Yeah,
Yes, so
and I also
story.
get the reference from my family member, so it would helpful to me to
Mhm.
figure out, am I writing the correct story, or what looks good, what looks bad, and all that stuff. So you get, if you have some teachers or you have some members from in your family that help you. Uh, I didn't have the English background, so I didn't know what the grammatical mistakes and all are. You can also get some professional help, but that will again cost you money.
Yeah.
So yeah, And
I
sometimes library can also help in the USA. If you are in the USA, you can go to
just
the
got
nearby library. And
get libraries.
I go for the TOEFL. Yeah, I went to the library to study, and they have some people that can help you with the English like speaking thing.
Mhm.
So I did one or two times, and they're doing really volunteering help, and
Wow.
we don't have to pay anything. You just need to spend time though. So after work, it's hard, but I spend 1 hour over there every week or sometimes. Yeah.
Oh, guys, take a note of that. That's, I mean, I don't know if it's possible now with pandemic, but it may be.
Yeah,
But
pandemic. Yeah.
that's a nice thing. And
Pandemic, yeah, but they usually do the Zoom also. So now they want to make a community and talk with the community, and they want to like grow in the little town. So they are doing all of them, even though libraries are closed. But if you sign up for the library and ask for the help, they will always help you.
that's nice to hear. That's very nice to hear. Yeah, I mean, building community is everything. So, and I mean, like you said, it's a new program, right? And I'm think if I remember right, your class size is not too big either, right? Like it's a very intimate, cozy class size. So I'm guessing you're connected more to your program director, like in a closer capacity. So keeping that in mind, what is it okay to email the schools if you have any emergency, any updated profile information, or do you
Yeah.
think that's frowned upon? What do they say in the school, in your faculty and your program director?
So because I'm in the can ask to there is always the email address or something that you can refer to for the support questions.
Mhm.
So you can ask them and just wait until they respond to you. And there are some because I applied to the COVID year, there were hard to get calls to the schools,
Right.
and sometimes they are not working, and sometimes they are also working
Yeah.
from home. They are all not connected with each other, so it's
Mhm.
hard for them. So yeah, be patient, and then you can also directly contact to the school if you have any question, but ask uh, like intelligent question, not whatever they have already posted on the website. Yeah.
Exactly. Yeah, we are coming back to the same point, I guess. I agree. Too, I've seen because they're not sure if they should. But there's a fine line. Like she said, and we were discussing before, don't ask unnecessary questions, of course, because you're one among, you're a drop in the ocean. How did you prepare for your interviews? Like, did you get a call from any other schools, or it was just Nebraska?
No, I did not get any of the call from other schools because it's already late. I finished my application June, July around,
Okay.
because I stuck with the recommendation letters, and
Mhm.
I contacted multiple schools for my TOEFL score as well as my documentations. Uh, and then I figured out if they don't allow, then there is no point applying to the schools at this cycle.
Okay.
So then I just shortlisted my schools, and then I got interview call from Nebraska, and then
Anyways,
I got
one school
what's
and
that?
you got one school and you got into
Yeah,
that.
I was also surprised at that time. Like all the people, just like you said, there are myths. Like people say, is if you don't get in the first cycle, like first cycle is always hard for everyone, and it is a myth that you don't get into the any school. And I just didn't lose hope. I was just thinking, I will if I get only one interview, I can I can
Yeah.
do that. And then it
That's a
happened.
good lesson here.
Everything
Like
happened. Yeah.
what she did is she even though she had a few roadblocks with respect to TOEFL or LORs or whatever, you sort of analyzed and saw that these schools might work for you, and you didn't give up hope and you went for it. And a lot of this is statistics, right? I mean, we are all of the applicants are not fighting. That's a negative term. I mean, you're all striving to get those designated spots or seats. So
Yes.
even if you're great, because I've heard these admission committee members say that there have been times where they wanted to call more people for interview because of amazing profiles or similar profiles, but you can't because you need to narrow it down. So there's so many factors at play.
So here you need to work smart because
Mm.
um, Nebraska have very limited class size.
Yeah.
Iowa has limited class size, but I chose the school because I knew that this is a limited class size. Not many people are applying to the school, but I really like the curriculum. All the school in the USA are really good. I'm not saying this school is good or that school is good. All the schools have their specialty. So if I am thinking Nebraska has a good like curriculum and it is matching with my profile, I'll choose that. For interview process, I did get very less time, I would say, because once I started preparing for bench exam in January, even though I am not prepared for my application and I was not prepared for my interview as, but I
Okay.
started preparing for my bench exam. I started from the back, and then I found out that because everywhere is a competition. Bench exam, if I want to get into the any classes, it will be on site. I cannot, I don't want to go there for 1 week and then practice at home. So I chose to practice bench exam from online studies, that is International Dental Central. I got that bench practice test.
Bench
So
mastery.
that yeah,
Yeah.
that. But then I did not apply for any interview prep uh, during that time because I
Okay.
don't have enough time. And I from TOEFL I already knew, so they were gonna ask from there. And then the day before there was one free talk with the International Dental Central, and then she was like. You need some more practice for the interview. You shouldn't be going to your dental assisting work. And I was like, the where I was working, there was really a need for me. I couldn't be absent for my interview. I know that interview for me is also very important, but if I can help them for half a day or something, it will be good for them as well. So I cannot skip
Okay.
my interview as well as the work. So I was like, uh, I I have to go for the work for the day, and then once I come back, I can practice. So it gives me some satisfaction that I did some good. Even if I didn't go to the work, I felt like she might have like tried so hard today or something. So I did go for the work, and then I came back, practiced for my interview, and then I have to fly to the Nebraska before my interview day with my husband. So really good faculty and students and staff and everywhere. So it like I liked it. And during the interview, there are multiple mini interviews, kind of like three rooms were there, and then two faculties in each room.
Mm-hmm.
I got into the two rooms, and then they asked me simple questions, very simple and regular questions. Okay, how are you feeling? They make you really comfortable during that day. So, and they asked me one question, who do you admire the most? So this is not related to the dentistry at all. It's
Yes.
just a admire, yeah. So if you have, and no one can prepare for this question, right? It's so simple. You cannot say, I admire Gandhiji. Yeah, you
Yeah.
can say it if
Yeah.
you are admiring him. So this is really a honest answer. And for dentistry, they asked me, because I have a general dentistry experience, they asked me simple questions. What are the things you have done? What do you see in perio patients? Did you had any uh, have you treated any kids? Okay, so what approaches did you take and all? And then in the second room, they already had my profile and my SOP in their hands, so they can ask questions from them. So they made me fun. Yeah. So they just asked me, okay, you asked if you wanted to come here, what are the things you can do? So I put it, I like cooking, I like gardening, I like different things. So they They just asking me, if you come here, there are some opportunities, you can do garden here and all that. So it's simple, and it's just a talk,
Yeah,
nothing serious.
conversation. Yeah, that's like
And
you said,
then
you for everything. You just need to
yeah,
prepare to.
and for the interview day, they also asked to write down a simple one sentence, like 10 sentence short
Okay,
answer about uh, why you chose to come to the US, UNMC.
okay, okay. All right. Yeah, interview. It's nice that, by the way, that you chose to go to your clinic. That's very
Oh,
endearing.
yes.
That's nice. And yeah, like you said, you can't prepare like, for everything. But like, they said it at IDC, it's nice for you to detect whether you need more practice because it'll just give you that, thought that I just needed to talk more. Like this again brings us back to family. Even like, during our interview coaching sessions, we tell our mentees that the best way you can actually do this is prepare your like sort of dig into your memories and story, go speak to your family, just go speak to them, just go talk to them. And then the next step would be, if you have the time, you should go and speak to strangers. Like imagine your strangers or semi-strangers, acquaintances, tell them an answer, and then ask them if they understood what you're talking about. So,
Yeah.
it's sort of, they tell you if you're giving, if you're making sense. So there are multiple ways by which you can actually ground yourself and prepare. Again, I think comes back to the SOP or writing, right? Like scan yourself, see if you can prepare on your own, because if you can, then that's the best. If not, then you can take a
Yeah,
professional help or
everyone, I think everyone needs help for all this kind of a work. But if you have someone who can encourage you to do stuff, then you can do it. Yeah,
exactly. Yes.
just need a confidence to do the
You
work.
definitely need that. I think you need a cheerleader through this whole thing in some way or the other. Anyone, like your friend, any kind of support system
Yeah,
to just,
just to
take
support.
you to
Yeah,
the finish line. Especially, I think it becomes more and more important as if you are doing multiple cycles. But even if it's just one cycle, it's good to have because it's a very long process, right? Minimum a year from A to Z, it'll take you like more than a year actually. So it's a long, long time. I told you guys earlier how I stumbled upon Dr. Khushbu was because she was sharing this link to a survey that the students, a few of them at Nebraska, was trying to do a survey to understand what difficulties applicants faced during COVID applications, and they were trying to sort of bring some good out of it. So especially you're doing some work in that, and you're a COVID applicant yourself. So, how do you think applicants should proactively, do some things to tackle this particular problem? Especially now, this year also, we might see a few implications of COVID here and there. So, how do you think they should? Number one is proactively tackle it. Number two would be, what are the alternatives? Like, a lot of things have turned virtual. So, how
yeah.
do you think they can make use of that?
So have to look for the online CE courses. One is Viva Learning, one is Colgate. There are so many free courses out there. On just Google it out and find out which one do you want to do. If there are some opportunity that you can do on classes or CE programs, that you can do it.
Hmm.
And now I did some volunteering before for the profile build up, but now with the COVID, I'm not sure all day. But we got the responses more like they have less work experience for due to the COVID. So yes, it is hard to get into the work experience, but just try look at there is always a need for assisting or observe. If you are interested in clinical work, go ask to the different practices uh, to just observe and help them. They'll always ready to, like, I think because of the COVID, they also have a short of staff, so they might have
Yeah, yeah,
you
that's
come.
true. Yeah.
So that kind of things is different what we used to do, because I used to do in India, which is different than what I practice in bench exam and the
Yes.
bench test, and now, and what I am doing right now in the school, which is also different. uh, the fundamentals is always the same, but what we are preparing, and I asked, I have like in my bench exam, they asked me for the zirconia prep in a class restoration. I'm not sure that they have done for this year as well. I'm not sure about that, but um, gold crown preparations, PFM crowns, all are different, and the fundamentals you have to know before you start preparing, and you have to show it to the faculty here or someone who knows the preparations in the USA, how they do, then only you will get the review. Because your prep, you are thinking you are doing it correctly, but which is not correct for the exam purpose. So just
Yeah.
think about that.
Yeah. Like, are you open to learning? Are you coachable? And are you being honest? And that's
Yes.
it. I know it's easier said than done, but honesty and being genuine in your application. And this is not even from my mouth or even not from Khushbu's mouth. Even if you listen to admission committee members, admission representatives in schools, that's the only thing that they keep saying. That's what they're expecting.
Yeah. I would say the student needs to be like honest and curious about what they wanted to do, and not just to get the license and start working. No, it's not
Yes.
like that. So be curious and hopeful
All right.
and thankful as
I like that. I like to end on that note. Be curious, very important. Be hopeful, which is also very important. Be thankful. All I think I really like the three words you used. All important, and not just in the application process. I think in life also that is helpful. It's always good to keep. I mean, just continue being curious and hopeful and just thankful and empathetic overall, and just be there for each other. Kindness matters. So, on that note, thank you, Dr. Khushbu, for being kind and for taking up the time. And she really was understanding. Like, we connected and she agreed to come and speak and take this opportunity and do this for us and for you guys. If you have any more questions, you can drop them in the comment box, and we can ask Dr. Khushbu for you and get back if you have any specific things to ask her. And apart from that, any other doubts or queries you have, again, reach out to us or leave those messages on our comment box and we'll get back to you. And yeah, keep watching us for more content. We're hoping to curate more content that will help you, and fingers crossed on that. So have a good rest of the night, Khushbu, and I'll talk to you soon again. I hope we keep talking because it's always good to keep hearing from the ones in school, because that's where the real experience lies. And it was fun talking to you. Thank you.
thank you so much, Flame. Nice talking.
Yes, pleasure was mine. Bye bye.